A multi-drug resistant tuberculosis survivor and clinical research fellow for the Africa Health Research Institute, Dr. Zolelwa Sifumba, says that TB patients are still being stigmatized by some healthcare professionals at treatment facilities. Dr. Sifumba, who contracted MDR TB during her medical training 10 years ago, shared her experience with delegates at the South Africa TB conference in Durban. And she interviewed different TB patients at various healthcare facilities in the country as part of her research. Dr. Sifumba says that many stigmatized patients were even thinking of quitting their TB treatment. Let's cross now to our reporter Minoshni Pillay, who's been following developments at the 7th South Africa TB conference for us, and she obviously will take us through what has happened, what is to come, and will obviously speak to some of the guests attending the conference. Minoshni, good morning. Always great to see you. So it's been a busy week, a long week of discussion, so please take us through it.
Yes, Sakina, good morning to you and the viewers. We have reached the end. It is the final day of the 7th SATB conference in Durban. And what a week it's been, like you've said. Critical, engaging conversations between various stakeholders, civil society, healthcare experts, government policy experts, and critically scientists and researchers. You know, regaining control of the fight against TB in South Africa post-COVID, 2 years, resources, research diverted towards the fight against that global pandemic. But time now to regain control of TB in this country. You know, Professor Willem Hanekom at the opening telling us that the country suffers 25,000 deaths from TB annually. But this morning we are shifting focus a little bit and zoning in on pediatric tuberculosis in South Africa. A 2021 global TB report by the World Health Organization noting that in 2020 over 1 million children being infected by TB. Just over a quarter of these dying from TB, and of the 225,000 deaths in that report of children from TB, over 80% under the age of 5. Really concerning. But to tell us more, we are joined this morning by Dr. Karen du Preez. She is from the Desmond Tutu TB Center in Stellenbosch. Dr. du Preez, good morning and thank you for joining us.
Good morning, Minoshni. Thank you for the opportunity to tell the viewers something more about pediatric TB.
Wonderful. So let's start at the beginning. Is pediatric TB a concern in South Africa?
Yes, Minoshni. Pediatric TB is definitely a concern. So we know that children, especially if they're young or living with HIV, have a high risk of developing TB, especially after they've been in close contact or exposure to an adult or a person who has TB. So children also has an increased risk of developing severe forms of TB, like TB meningitis, and that is TB of the brain and the fluid around your brain. So they're really an at-risk population.
Throughout the conference, talking about TB in general, there's been a lot of conversations about concerns about people that have TB but that are undiagnosed. You know, they may have the symptoms, they may not be going to a clinic to be tested. What is the case in this regard to children who are undiagnosed? During your presentation yesterday morning, you briefly touched on this. Just take us in and share those details with us.
Thanks. Yes, Minoshni. So actually in South Africa, we have about 30,000 children with TB every year. And less than half of these children are diagnosed and started on treatment. And in children, the diagnosis in children is a bit more complex than in adults. Because in adults, they have lots of bacteria, so it's quite easy to confirm your diagnosis of TB. Whereas in children, they get a different type of disease where they have little bacteria on board. So we don't often have a confirmed diagnosis, and it's almost like putting a puzzle piece together. You have to look at the symptoms and the history and the bacteriology and your radiography, and then you all put that together to get to a diagnosis. In addition to that, as adults, we can easily cough up sputum samples, but in younger children, that is really difficult. They can't give us sputum samples on their own, so the procedures to get that samples are a bit more invasive and time-consuming. And then, sorry, one last thing is they also access healthcare systems different than adults. So they often would go to hospital if they have more complicated disease to get diagnosed. So they have to move between different levels of the healthcare system. So all of that contributes to this large group of undiagnosed cases.
Let me ask you then, what signs does a parent need to look out for? Because like you say, with a child, we may miss the symptoms. So whose responsibility is it? Does it start in the home? And what are some of the early signs for a young child?
Yes, I think it's a shared responsibility. So from the parents being aware and understanding the risk, and then also from healthcare workers to have a high index of suspicion when you see a sick child. And the symptoms in children are also often a bit non-specific, but you can look at the same symptoms like chronic coughing, loss of weight. They often have lethargy, so they're just not playing as much and they're tired. But the main thing is exposure. So if you know that they had TB contact or they were exposed to an adult with TB, that from an parent perspective is the main important factor to then take your child to the clinic.
All right, Dr. Karen du Preez telling us more about the situation of pediatric TB in South Africa. Definitely an area of TB that we don't hear much about, but something that is of vital importance. The final day of SATB in Durban. Sakina, it's back to you.
Well, thank you so much, Minoshni, and such important discussions. And these are, of course, things that we tend to place on the back burner, issues such as TB and the attendant problems, mostly because, one, perhaps it affects more poorer communities, and two, it takes a backseat to other so-called more important disease issues that we have to deal with. But very important discussions being held in Durban this week.